I want to now turn to one of these future sites for a vaccine pod. For those of you, again, who are concerned that the rural areas are going to be left out and it won't be served by one of the larger hospitals, I'd like to show you and share with you a story with a smaller health center, again, on the windward side in Representative Lisa Martin's district, that will be able to serve the rural areas of Waimanalo and its surrounding areas. So if we could cut to that clip with Lisa Martin and Waimanalo Health Center.
I'm here with Dr. Christina Lee, who is at the Waimanalo Health Center.
I'm the Chief Medical Officer at Waimanalo Health Center.
Chief Medical Officer. Waimanalo Health Center really takes care of this community from preventive outreach type programs all the way to their care, dental, everything. It's such a fabulous facility, and they are, of course, going to be involved in the next super important medical need here, which is going to be vaccination for COVID.
We were so fortunate that Castle Medical Center agreed to vaccinate us. You know, we all got to sign up on their system, and it was very, very easy process. They were so professional. It was so easy to get in and out. I quickly got my vaccine. We of course had to wait the 15 minutes after so they could monitor and make sure that we're okay. And then at the end of that, they give you a card just to go, for your next vaccination. I was so impressed with how seamless the process was for us. In the end, I'm so happy to say, like, all of our providers got vaccinated, and they were all very happy and excited to get vaccinated.
Now, how does it, knowing now that you had your second dose, right? So
we have not had it yet. That's next week. Next week we'll get our second dose.
Okay. But how do you think that will make you feel?
I have to say, like, already, having gotten the first vaccine, I feel so much more comfortable, and I know it's not full protection yet, but it's still a good amount of protection, I mean, I'll just feel so much better knowing that, like, for all of us, that we're all protected and just can feel more comfortable in taking care of our community. Yeah. I mean, that is our primary focus.
I can totally relate to that. I was in the Pfizer trial.
Oh!
And so I actually got vaccinated in September.
Nice.
I assume I got vaccinated. We'll find out for sure when it's my turn.
Mm-hmm.
But it makes me feel less worried about being a transmitter. Now tell me about the plans here at Waimanalo Health Center for doing immunization when the time is right.
Yes, thank you for asking. So we are in the planning stages, really just trying to put in all of those pieces so that when vaccine is ready for us to be able to order, because we're not able quite yet, the state hasn't given us the go-ahead, but when we are able, we'll be ready. And we are also looking at reaching out to our patients and let them know, hey, we're ready, come in.
That's fabulous. And then of course you would have the data on who has conditions that would make them more vulnerable and would therefore qualify earlier, and you can reach out to them.
Yes, absolutely.
Now, what kind of concerns do you think the community might have that would make them hesitant to vaccinate, and how will you address those?
Yeah, I think there's just so much misinformation. Having that reassurance from your own provider that knows you and your medical conditions in your situation goes a long way. And a couple of concerns is, well, it hasn't been out long enough. It's not that corners in the trials were cut. It was the business, the manufacturing happened in parallel with the clinical trials. So the fact that the government gave a lot of money toward this effort to allow these two processes that normally happen one after the other together side by side, that's what's allowed us to get this so quickly. And also, it's not that the mRNA technology is brand new. I mean, mRNA has been studied, for a decade. For some people, there are side effects. We know about them. Usually the side effects resolve within 1 to 2 days. The vast majority of the side effects were considered mild maybe mild to moderate, rarely severe. But do you want to have 2 days of these minimal side effects? Or do you want to risk catching COVID-19, which has been largely associated with many long-term side effects?
No, I'm just so grateful to everything that the Waimanalo Health Center does. You know, the staff here is so caring and just always goes the extra step for the community. And Waimanalo is so lucky to have a health center here like this.
I just really encourage everybody to get their COVID-19 vaccine. It's been proven safe and effective in published clinical trials. So it's just so important that if we all want to reclaim our lives back again, if we want to get back to school, get our businesses up and running, like this is the way to do it. This is the path to do it. So we all have our own responsibility to be a part of that solution. And luckily, we're so lucky to have a vaccine that's so effective.
I agree.
Yeah.
So it's really great to see these pods like Waimanalo Health Center getting ready. And we know that people like Chair Yamane will continue to be out at these pods helping and assisting the Department of Health and the state.